Your day just got better.
Social media plastic surgery. From several weeks ago, we did a segment on plastic surgery alternatives with Dr. Stephen Davis, which was amazing.
Fabulous.
We got a ton of comments from our viewers about how much you loved the segment, and you sent us a bunch of questions. So today, backed by popular demand, Dr. Davis is here.
He is. He's going to talk about, he's got all the answers to your questions. He's going to talk about the effect of social media on cosmetic surgery.
Yeah,
Isn't that interesting?
With the continued rise of social media, some people are starting to take the selfie thing a bit too seriously.
I'm one of them. It's true. Plastic surgeon Dr. Stephen Davis is back, and he's going to tell us about the latest products and procedures people are using and requesting to help them look better on social media. Welcome back.
Hi, it's nice to be here.
Good to see you again.
So there's some interesting trends out there, what people are seeing in themselves, I guess, when they take selfies, right?
It's true. One of the first things that they talk about is something called tech neck. And what's happening is they're taking a picture of themselves and they're bending over and they start to see a little bit of laxity in their skin of their neck and their face. And people that never thought they had jowls before, all of a sudden are getting jowls. So when they come in and talk to me about it, in reality, gravity's going to play a lot of bad games on you.
Right.
So you really have to understand what you're doing when you're taking those photos.
You got to look up, right?
Right. So
Yeah.
that's the first trick.
We should have a selfie etiquette segment.
Yeah,
That'd be
I thought that was a trick. You look up.
That's it. Well, that's one of the first ways to make plastic surgery really easy, is you just look up, and it makes it even easier.
But what can you do if you really want to do
Well, if you want to do something non-surgically, really, there's so many things out there that tighten skin. And one of the things I brought along with me today is something called Pellevé.
Okay.
And it's a radio frequency device that actually applies heat to the skin, and if you do it over a repetitive amount of time, it'll cause the collagen in your skin to tighten, and you can really do that totally non-surgically, doesn't hurt, just heats up, and you can do it along the jawline and the neck area, and again, it really does work very, very well.
But you can't do that at home. That's a, that is
this
a
is
medical
an in-office
device.
procedure.
Right, in-office procedure,
I
something
mean, that thing
you
looks
could
like
do.
I could take it home and do that right now.
I
on my
know, they
face.
do make it look very, very easy to do.
Yeah.
But there's a couple other types of radio frequency type devices, even ultrasound type devices that can make your neck start to look tighter and your jowls start to look better.
Wow.
One of the other trends, go ahead.
What about the second trend, which is like bat wings?
Bat wings.
I know.
So
is that what this is?
Oh, yeah.
Right. So when patients talk about they're waving to somebody and all of a sudden things keep waving under here.
Right.
So that's something that we're calling bat wings, or some other terrible names have been called bingo arms.
Wings or
really
something,
bad.
yeah.
So one of the things that you can do non-surgically, of course, is something called cool sculpting, which is a really exciting thing, not just for arms. You can do it for your abdomen and love handles.
I've heard about this for men's love handles, actually, quite a bit. Yeah?
It's an applicator that puts cold, freezing temperatures on the skin itself, but it's very specific to just go after the fat, and it'll freeze the fat, and literally within a month, that fat's gone.
Where does it go?
Your body just dissolves it. It kind of...
You pee it out is the answer.
Well,
you expel it, right?
It's exactly right. You excrete it, just like if you had like a whole bowl of French fries. Like, how would you handle all that fat that you just ingested? Same kind of thing. It would be a way of like metabolizing it out of your body. So you can use it there, and you can use it on your arms. Liposuctioning is the surgical way of really going about getting rid of that fat under the arms, as well as love handles and everywhere else. So that's another really good way of doing that.
Right, okay.
And selfie surgery is the last trend. What does that mean exactly?
Well, with so many people taking photos of themselves, so we're starting to see people come in and say, you know what, I'm taking a picture of my new engagement ring that I have on my hand, and their hand starts to look older than they really would like it to look. So all of these products...
self-conscious all of a sudden.
all of these products that I brought in are a way of injecting those real narrow areas that start to make your hand look old. Right. And you can actually inject those areas and make it look more plump. Makes sense.
It's fillers, essentially.
Fillers.
There's nothing really naturally that you can do for your hands, is there?
Well, for natural type things for your hands, again, it's not the most natural thing in the world, but there are certain lasers that'll take brown spots and red things off of your hands very easily. So people that really are looking at their hands and they're saying, you know what, I'm kind of doing a good job up here, but I better start doing something here, because they're taking, you're taking pictures of everything these days.
We're both sitting here staring at our hands going, I wonder if I need to do
I'm very worried. I'm very worried. Well, please don't go anywhere, because up next, Dr. Davis is answering your Facebook questions. We are back with Dr. Davis, and it's time to answer some viewer questions. And I'm going to start it right off with Andrea Tanner. What do I look for when trying to find a plastic surgeon?
Good question.
That's a really good question.
Because they're all over the country. So
I know.
How do you find a good one?
You definitely want to make sure that they're board certified. That's always a good place to start.
Yeah.
But then when you go in and interview them, and you're having a consultation, so you really want to make sure you're interviewing them as well. Make sure that your sense of aesthetics meets theirs. Because one of the things that we see a lot is that patients that really went to a really reputable, wonderful plastic surgeon just may be known for doing things a little bit too aggressively, and that may not be what your taste is.
Right.
So you just want to make sure that you're on the same page.
How do you do that? Do you look at photos? Do you,
Yeah.
Can you talk to prior patients or
That's
what?
a great thing. The three things that I always talk about is patients will bring their own photos of like actresses and things that they would like to look like a sense of aesthetics. Like, I love this nose on this person, or I like the way this facelift turned out. The other thing is, ask the doctor to show some of his before and afters to get a sense of what's his, like, MO for how he likes to do these things. And the other thing is always a great idea, ask to see if some patients would call them. So it's, you know, with HIPAA violations and things like that, you just can't give out
Right.
patients'
phone numbers,
Right.
of course.
But we do have patients in our practice that always say, if anyone has any questions about this procedure,
Or they're so
please
happy with their
Yes,
experience,
that's
they want
exactly
to
right.
share it. That's nice.
Here's another
good.
really good question, and something I've actually always wondered. It's Cadence Seymour. She says, if I get breast implants now and then I have children later,
Right.
can I still nurse the children? Can she still breastfeed?
Oh, I hear that all the time. You know what? The answer is yes. If you put the implant behind the muscles of the chest, you really should have no trouble breastfeeding. Now, the only question that comes up is how much milk will actually be housed in the breast. And sometimes because of the implant, you may not be able to hold as much as you used to, but the actual ductal apparatus or the suckling ability of the baby isn't going to be
It's unchanged.
Exactly.
Right.
Well, here's one from Sonia Rodriguez. We kind of talked about the lipo. If I,
Yeah.
I want to get lipo, if I get the fat sucked out of one area, will the fat go to other parts of my body?
That's my favorite question. I love that. Everybody always asks that because the one key that people always leave out is that they gained weight. So think about this. If you're going to do liposuctioning, let's say on your abdomen,
Okay.
I've just reduced the amount of fat cells that are there permanently. If you stay the same weight, there's no reason to just assume, well, you're going to wake up one day and look like Quasimodo or something and have fat on your back. But if all of a sudden you're always comfortable looking in the mirror going, oh, look at this, I just had 3 pieces of cheesecake and nothing happened to my abdomen, I'm going to have another piece of cheesecake. At the end of a year, you're going to have gained weight and you're going to have gotten fat elsewhere. So the one question that people always ask, will the fat go somewhere else? The answer is yes, but that's because you gained weight. So you just can't have liposuction and then continue to eat and do everything you want to do.
So it won't go back in that area because those
Probably
fat cells
unless you
are...
really gain a lot of weight.
Okay.
Then it'll even go back there.
Oh,
But
okay.
most of the time, people will ask that question just thinking that magically fat's going to show up somewhere else, but that's because they didn't really curb the way they started eating again.
Right.
We've got time for one more.
Yeah.
Sarah Stanton, I recently lost 60 pounds. I've got saggy skin around my tummy area.
Yeah.
Is there any kind of non-invasive or minimally surgically invasive procedure I can get to reduce the skin, or is Tummy Tech the only way?
You know, I think that patient would be the best patient to go in and actually have a real consultation and an exam, because if it is a small amount of skin, you can do things like these radio frequency energy things where it will cause the skin over the course of time to shrink up, but the tummy tuck is still the gold standard.
Still the standard.
Well, thank you so much, Dr. Davis.
Great information.
Great information.
As always, keep sending us your questions, and we'll keep bringing Dr. Davis back because he's got all the answers. We'll be right back.
Thank you.